Hi guys, my name is Dr. Nina. I'm a facial aesthetic physician. I am based in central London in a clinic in Belgravia. So today we are going to discover everything about the new, most effective, non-surgical facelift called the Endolift. So the Endolift is a laser-assisted treatment where I use a very fine optical fiber, which is exactly this one here, so very, very small, that basically helps me to achieve two objectives. One is skin tightening and the other one is fat melting. So this treatment is really new, has been around actually in Italy for quite a long time, but it's quite new in UK. The treatment is quite quick. It lasts anything between half an hour to an hour, and then the results actually last up to a couple of years. So the fat melting is actually permanent unless you put on weight, but in terms of skin tightening, it actually lasts for 2 years. So the advantages of having this treatment is that compared to obviously a surgical facelift, you have a much quicker recovery. You may have a couple of days of swelling, up to maximum couple of weeks. You may have a bit of numbness as well for a couple of weeks, very, very normal, but no visible sign, very unlikely to have any bruising. There's no general anesthetic, there's no cutting, there's no stitches. Everything is done in a very conservative way. So to make the treatment not painful, I'm going to inject local anesthetic, which is ironically the most uncomfortable part. Once that's over, you're very obviously numb, you're comfortable, so the actual treatment is not painful at all. As I'm in the clinic, as I said, less than an hour, and then you can absolutely go back to your normal routine or back to work in no time. We've got Katie here today, so her main concerns is the lower part of her face, so these initial sagging that she's noticing around the jowl. So in facial aesthetics, especially in non-surgical aesthetic medicine, the area that we struggle the most with is exactly this, because with the typical injectables, so neurotoxin known as Botox or dermal fillers, we can't really lift. So we can replenish the volume, soften the muscle activity, but actually when it starts to drop down, which is normally from 35 plus, we just need to lift. So the first treatment that we're going to do today, if I have a treatment plan, is to use the Endolift, which will target exactly this. So we just want to first tighten and lift these lower part of her face. And also in neck here and also below her chin. So the first step is not filling or doing Botox, but it's actually lifting. So the Endolift is by far the most effective way of giving a non-surgical facelift. So I'm going to be doing her treatment around the lower part of her jawline, so her mandible here, on the side of her neck and around here as well. So that will be exactly what we're going to do today. Then she's going to have the peak of results will be anything between 3 and 9 months from today. But in about 4 to 6 weeks, we're going to complete a treatment plan. And based on how much the Endolift has lifted, then I may do a bit of fillers in the cheeks and the nose to mouth lines. So we basically fill the lines and contour her cheekbones. A bit of neurotoxin into her masseters, because the muscles are very strong, and again, that in combination with the laxity just give her face, it's a bit bottom heavy, so we just need to slim it down. and also a little bit of neurotoxin in her forehead, just open her brows nicely. Plus, we're also going to do a bit of profiler just to work on the skin texture above where the Endolift box. So let's do this. What I'm going to start with is doing the anesthetic, which is ironically the most uncomfortable part. So stings very slightly, and once that sits in nicely, then obviously she's going to be very, very comfortable. So just a tiny short scratch first, and then you're going to be nice and under, okay? It's just the pressure of the...
Yeah.
We just finished to do her treatment. It took around maybe 45 minutes. So I basically focused mainly on the skin laxity. So I just did the setting of the Endolift, mainly for skin tightening and also a little bit of fat melting, especially around this area here. So we targeted the lower face on both sides, this end of the neck, and also below the chin as well. In terms of aftercare, so she will feel a bit swollen and a little bit numb for a couple of weeks. Very normal. So what I'm doing now is just massaging the area. So what she can do as well at home, she has to help her face just to get rid of all the fluids of the anesthetic, mainly that we injected. So numbness and swelling for a few weeks, very normal. As you can see, there's no signs of any treatments that have been done. So the entry point being the laser so small, you can't even see where you went in. So it's, as you can see, there's no even bruising. So you can't even see anything from externally. And I can already feel the skin much tighter. Obviously, she's very swollen, so the final result will be seen a couple of weeks, but the actual peak of results will improve and get better, and will be around 6 to 9 months from today. We normally say the results last for about 2 years. In the next few weeks, she has to be careful not to expose her face to too much heat, no exercise, no makeup for a couple of days. But other than that, as you can see, it is a lunchtime procedure. So I hope this was fascinating, interesting. So if you have any other questions, or if you're interested about the actual procedure, please feel free to contact me. And otherwise, thanks so much for watching. Please don't forget to like the video and to subscribe also to my channel. Thank you.